begin the media availability with the Chief Medical Officer giving the update for today.
Good afternoon. Thank you, Premier. Thank you for joining us today. I'll begin with an update on the number of cases in our province. Since the media briefing yesterday, we have 14 new positive cases. These cases are within Eastern Health. The public health contact tracing is ongoing, and everyone considered close contacts will be advised to quarantine. The number of cases in our province is now 217. By region, we have 207 cases in Eastern Health, 3 in the Central Health Region, 1 in Western Health Region, and 6 in Labrador-Grenville Region. Of the 217 cases, 167 can be traced back as related to Call's Funeral Home. 53% of cases are female and 47% are male. By age, we have 19 people under the age of 20, 29 between 20 and 39, 33 between 40 and 49, 49 between 50 and 59, 45 between 60 and 69, and 42 who are 70 and above. 10 people are now in hospital due to the virus, and of these patients, 3 are in intensive care. 28 people have now recovered. In total, we have tested 3,565 people. COVID-19 is a new virus. There is no cure, there is no vaccine. The measures we have in place, if followed, will help us slow the spread and reduce the impact on our healthcare system when we reach the peak of cases. We need this time to prepare, so we are ready to manage the surge that will undoubtedly come. The emphasis I place daily on the importance of physical distancing is because we know that keeping our distance from others has proven to be one of the most effective ways to reduce the spread and impact of COVID-19. How long our physical distancing efforts last and how much we can flatten the curve depends on every single one of us following these measures. Our province is not unique in that we have many vulnerable populations. People with underlying chronic health conditions, compromised immune systems, and individuals who face socioeconomic barriers, including homelessness. These individuals are more at risk of developing severe complications from COVID-19, and it is our collective responsibility to help protect them by doing our part to slow the progression of it in our province. Even if you are not hearing of COVID-19 in your community, it does not mean there are no cases or exposures waiting to happen. Stay home and stay safe. When you protect yourself, you protect others. Today, I would like to acknowledge and thank leaders of our faith communities who have begun offering online services. This new format will help meet the needs of the members of your communities who rely on the support and comfort of their faith, and will help promote and maintain social distancing and reduce the spread of COVID-19 in our communities. COVID-19 related news and stories have captivated us all through TV, online, and social media. While staying informed is important, I encourage you to ensure you are getting the right information and in the right amount to avoid information overload. Our government website contains resources, frequently asked questions, and links to other reputable sources such as the Public Health Agency of Canada and the World Health Organization. Please visit gov.nl.ca/COVID-19 daily for the most up-to-date information related to COVID-19 in our province. As a recap for those who may have just joined us, we have 14 new cases since yesterday's media availability. The total number of cases in the province is 217. The breakdown by health region brings us to 207 cases in Eastern Health, 3 in Central, 1 in Western, and 6 in Labrador-Grenville Health. We are still in the early days of COVID-19 in our province. We all need to work together by staying apart. Remember to stay in your bubble. Wash your hands frequently and well, and stay home if you are sick. Our collective actions will have significant impact on how COVID-19 progresses in our province. Thank you.
Thank you, Dr. Fitzgerald, and good afternoon, everyone. The world is facing something that it has never experienced before. This virus is spreading across the world at a fast pace. We now have over 14,000 cases in Canada. The virus has turned our daily routines upside down, and we have been asked to change how we live our lives. Since day one, we have expressed the importance of cooperation and collaboration. We stress the significance of working together through this pandemic. And we have been listening to you. We hear your concerns. We know that you're worried about the possibility of you or your loved ones getting sick. We've been working with you to help you through every corner of your life. Every piece of our work as a government has done to protect and to support you and your families as we continue to navigate our way through this pandemic together. You are our number one priority. You must live your life like the person that you see next as COVID-19. This is how we must act. One of the great lessons in humanity is that in a time of crisis, you don't stop being human. In 2001, our province stepped up in the biggest way possible. When the United States was in crisis after the terrorist attacks in New York, Newfoundland and Labrador accepted with open arms thousands of people from around the world. With no questions asked, with no prompting, Newfoundlanders and Labradorians acted fast and they did what was necessary. Today we are no different. We help others. That is ingrained in our nature. Since 9/11, Newfoundland and Labrador's hospitality has drawn worldwide attention, especially through the Broadway musical, Come From Away. So today, to say that I am infuriated with the recent actions of President Trump of the United States is an understatement. I cannot believe for a second, in a time of crisis, that President Trump would even think about banning key medical supplies to Canada. Newfoundland and Labrador will never give up on humanity. We will not hesitate for 1 second. If we had to repeat what we did in 9/11, we would do it again. This is a time when we need to work together to continue to protect our residents and to keep them safe from COVID-19, no matter where they live or what passport they hold. COVID-19 is a turning point in our history, and the people of our province will continue to shine with their kind nature and willingness to go above and beyond for those who need it the most. As leader of this province, I am beyond proud. More than ever, we need one another, and we will continue to work with our colleagues, work with the federal government, and work with you to do whatever it takes to protect and support you as best we can. The time is now. It's by working together that we will get through this. Thank you. I will now turn it over to Minister Haggie for some comments.
Thank you very much, Premier Ball. I think I can do little better than start by echoing Dr. Fitzgerald's comments. COVID-19 is a new virus for which there is no vaccine, no cure, and no specific treatment. It spreads and exists because of interactions between us, and it only moves when we move. And that has been the logic behind some of the decisions that we have made. It's been the logic behind nearly all of the decisions we've made. People, for example, have written to me and said, well, why are we allowing the delivery of flyers? Well, if you see the way they're delivered to my house, it's certainly a true no-contact delivery. They're launched into the air and land on the step. But on a serious note, they provide financial assistance in the form of coupons for people, particularly at this time of the year and this time of the month, who are challenged because of income, and they add value and do it in a safe way. It has also been the underpinning logic behind what we've talked about in relation to gatherings. Easter is coming, and families tend to want to come together. There are religious services of significance, and we need to adjust the way that we deal with that weekend for the holiday. We really need to limit, to distance ourselves from the people who are normally close to us at this time of the year. The only safe assumption is that the person standing next to you has COVID-19. We've talked a lot about testing, but testing essentially reinforces the same message. If you have a positive test, you stay home. If you have a negative test, you stay home. And if you're sick, you never leave the house in the first place. One of the challenges that we have had has been around our information and our data. We've been criticized for the way we've shared it. And one of our concerns has been to balance the need for public information against that of individual privacy of health information. And certainly when our numbers were small, it was difficult to present publicly information that would jeopardize someone's individual privacy. We've passed the 200 mark now in this province, and I think there is a time now to revisit the idea of how we deliver our information and how we present it. And on the advice of staff, as of tomorrow, we're going to look at a way now to see if we can be more granular with the information that we provide. The logic behind that is to address several things. One is the conviction that this is a Metro St. John's virus. It's a towny virus somehow. That is not the case. Every regional health authority within the province has cases. Eastern Health, which has been the umbrella for this and been the excuse for some to think it's confined to Metro, actually runs all the way to Terra Nova National Park. It is a big district, a big region. And so we will be looking at providing map data that will give a much more granular idea of where these locations might be. That does not mean, again, that if it's not in your community, that it's not there. It simply means that you need to go back to what I just said, which is to assume that the person next door has it and to work on that basis and limit your interactions. Because as Dr. Fitzgerald said yesterday, if you can keep those interactions as low as possible, maybe 3 people outside your bubble each day, we can slow the arrival of the peak, and we can slow the size of the peak when it does arrive, because this is still just the beginning. We have not yet seen the full effects of COVID-19 on this province. These kind of news events are aimed to inform and by that reassure, but also they produce significant amount of anxiety. There is anxiety out there. In times of uncertainty, people crave certainty, and there's none that any of us can really offer you. What we can do, however, is offer you some supports if you are struggling. So I would encourage anyone who has the slightest concerns to turn to trusted sources of mental health support, just as Dr. Fitzgerald and the Premier have referenced trusted sources of factual information on our website. Bridge the Gap, that's 2 P's, all one word, .ca, has a wealth of support tools for youth and for adults. It ranges from simple mindfulness exercises to keep your ability to relax and avoid stressing yourself and sleep better, all the way to therapeutic courses online available for screened individuals or those for whom simpler methods would not be available. It's always there. We have Strongest Families. We have Breathing Room for Youth. We have anxiety programs that will help youth and adults deal with that. In addition, for those people who find that a challenge for one reason or another, we have deemed our Doorways program to be an essential part of our healthcare system. Just as physical health is important, people cannot be truly well without mental health supports too. To go back to the beginning, around the logic around gatherings, some of the concerns I've had addressed to me have been around travel. Well, if you don't need to go out of the house, you should not. The people who should be traveling at the moment are those that are essential to maintain our current level of service and the fabric of our society, really. So those should be people who are working in health or community support, food industry, gas bars, and working in the supply chain. If you do not need to be out, you should not be out. Once again, just want to close by repeating what Dr. Fitzgerald has said, and indeed what every medical officer of health, every minister of health, and even the Prime Minister as well as the Premiers have said, that you need to make a bubble for yourself and your family. You need to stay in that bubble, and you need not to go out and burst anyone else's. If we do this, and we do this now, and are strict about it now, then when the wave arrives, it'll be a smaller wave and one with which we can manage. If we do not, the the people who pay the price may not be ourselves directly, but maybe our loved ones instead. And there is no certainty around who it will affect. It does not discriminate. So with that, Premier, I think I turn that back to you, and thank you.
Thank you, Minister. We now open it up for questions.
For the benefit of our speakers, we have 5 reporters registered for today's call. In the essence of time, each reporter will have the opportunity to ask 2 questions. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. We will run through the telephone queue so each reporter has an opportunity, and following this, should time permit, you will be able to ask single questions only. This call will end at 2:59 p.m., and any further questions can be emailed. Operator, please proceed.
Thank you. If you have a question, please press star 1 on your telephone keypad. And the first question is from Heather Gillis, CBC News. Please go ahead.
Hi there, Premier and Minister Haggie. Can you tell us what this granular level of detail is going to look like and how you're going to be presenting information about COVID-19 starting tomorrow?
Yes, certainly. We're working with OCIO, who look after our website, and Fisheries, who do our GIS mapping, and it will probably take the form of a map with indications of sites of disease and numbers in that community.
And why have you decided to present the information in this way?
It seemed like it was intuitive. If on the basis of feedback people would prefer this in a different way, we can break it down pretty well anyway, the way people want, that is of use and serves the public interest and public health. From the point of view of getting people's street addresses or civic addresses, that's not going to happen.
Thank you. The next question is from Ben Murphy from VOCM News. Please go ahead.
Thanks. Dr. Fitzgerald, I know yesterday you outlined some expanded testing protocols, but I received a pretty troubling phone call last night from someone in tears. They were a part of this calls cluster and told to self-isolate, which they did, felt fine, but then 3 days ago came down with symptoms, coughing, fever, runny nose. Public health told them that they'd only test them at a drive-through clinic, yet they don't drive and couldn't get a drive there. And then they would not go to the person and actually test them. The person said they're petrified and public health will not support those who don't drive. What do you say to this person and others out there who don't drive?
So there are methods to get testing done if people do not drive. I can't speak specifically to that situation. I'm not aware of it in particular, but there are options for people who do not drive.
Can you go over some of those options?
So if they contact public health in their region, then we can arrange for someone to be able to visit their home to do testing. That's the options that are available now, the drive-by clinic.
The next question is from Jody Cook from NTV News. Please go ahead.
Good afternoon. This is a question for the Chief Medical Officer. I wonder if you could reiterate how long right now it's taking to receive positive tests back, understanding that the numbers that you give today are a snapshot of what we would have seen over the last couple of days, not necessarily today's numbers.
So generally speaking, when a test is done, once it's received at the lab, it's usually reported within that 24-hour period. Sometimes there are delays with getting, or not delays, but it takes time to get it from a regional health authority into our public health and microbiology lab here in St. John's. So it could take a couple of days to get a report, and we've said that it can actually take up to 5 days to get a negative report on our portal because of the time it takes to get the test kits in from the regions, and sometimes weather may have an influence on that. But generally, once it's received at the lab, it's usually done within that 24-hour period.
I'd like to ask once again regarding the new moms and the issues around childbirth. I know that there was once again a revisit to the initial rules that came out on Friday to allow support person in there for a little bit longer than a couple of hours. I think now we're looking at the 4 to 6 hour mark. There's some concern about services for people who might need support with breastfeeding, or new Canadians who have language barriers, those types of things. Could there be any exceptions made on some of these case-by-case considerations?
The discussion, Jody, has been around support persons. We have taken that to represent a non-care related individual who is providing emotional support to the mum. Traditionally, that's been the partner or the father, but it could also be another close friend. What you're referring to are care-related issues. If somebody needs advice on breastfeeding, each of the regional health authorities has lactation consultants who are available, and indeed in Central there are now midwives as well to help with that. Each of the RHAs has a bank of translators who are regarded as essential services, bearing in mind we have a fairly diverse ethnic population, and people do not always have English or French as their first language. So I would not, and the system does not, regard translators or lactation consultants as anything other than essential. They're not counted as support people for the purposes of this policy.
Thank you.
The next question is from Juanita Mercer from the Telegram. Please go ahead.
Thank you. Yesterday, you were asked about the rationale behind suspending parental visits to children in foster care. Premier, you said parents and children in care can use technology to stay in touch. Unfortunately, breastfeeding parents can't feed their children through FaceTime. For example, one St. John's doctor talked about a mother who has a 2-month-old in care and was breastfeeding with daily visits, but is now unable to do that, and her breast milk supply is decreasing. So given the health benefits of breastfeeding, but also the precautions around spreading COVID-19, how do you suggest these situations be addressed?
Well, one of the things that I did say in my remarks, to this issue, was first and foremost the safety of our children is paramount, and practicing safe distancing and physical distancing is something that we put out there as a guideline, and we expect everyone to follow. I also did say, though, that there would be exceptionalities that could be discussed as we monitor our way through this. And the example that you've given me is could be considered as one of those exceptional circumstances. I think that's something for the social workers who would understand this best, not the politicians, to work with those families, be it a caregiver or a foster care, or obviously in this situation it could be a child in care, within our system. So I think the answer to this would best be able to be given by the social workers who monitor those cases on a daily basis.
Thank you. And a follow-up to that, doctors with the Downtown Health Collaborative also expressed concern with government suggestion to use technology to keep in touch, saying oftentimes parents of children in foster care face disproportionate degrees of poverty, making technologies such as internet access or smartphones inaccessible. As a comparison, when it was announced that schools will be moving to online learning for the remainder of the year, the province said accommodations will be made for students without access to technology. So will parents of children in care be provided similar accommodations in order to see their children virtually?
I think it's a fair question, as Dr. and Minister Haggie and the Chief Medical Officer has discussed many times. This is a very fluid environment. This virus and the situation is evolving. And so the services that we provide to children in care and to other people across our province, we must make sure that the systems that we have, just like you just mentioned with the school system, can evolve as well. So I think it's a fair question that it's important as we put physicians across our province with giving virtual care, that we must make sure that foster parents and others that are providing services to kids in care, as an example, we must work with them to see if we can add those resources and those capabilities, because this is a necessary tool for us to continue to stay in contact with those children in care who need, from time to time, they need the security of foster parents, but they also will need to make sure that they can access medical care just like every other person within our province is able to do.
Thank you.
The next question is from Elizabeth Witten from All Newfoundland and Labrador. Please go ahead.
Thank you. I was hoping to learn a bit more about Task Force NL, the group of private enterprises offering their services to manufacture PPE locally. I'm curious, how did this come about, and what companies are involved?
From my point of view, the best suggestion I could make is the public face of that has been Miss Kathy Bennett. That question would be better addressed to her. Quite frankly, we've had many discussions, she and I, about the role that they can play and the areas of concern for government, and she's been responsive in attempting to deal with those. But I have no granular knowledge of particular players in that scene. Indeed, I got the impression some of them might actually want to remain anonymous. So I would suggest you would speak to her, as she's the public face of this.
So if I could, just to expand on what the minister said on this already, we put in place procurement measures within health and community services, and we really appreciate the work that Task Force in L has been doing, and as the minister has mentioned that many times. So so there's contact through the mechanisms that we have in place. Within government, we've added some capacity to the procurement side in health and community services, because there are quite a few companies and quite a few organizations around the province doing what leaders often do within our society. They're stepping up and putting in various ways where they can support us. So the key thing in all of this is making sure that the healthcare workers that would actually use the to protective equipment, with whether it's made locally, nationally, or wherever it's from, is that there's a level of comfort that they are safe. So we have a mechanism in place to be able to provide that level of safety as well. So, but we really appreciate all of those that are stepping up, like Task Force NL, to help and support our healthcare, our essential workers in our province. So we're willing to work with those groups, and we are.
Thank you. And as a follow-up, I'd like to actually know, when people talk about PPE, what are those pieces of equipment? Because I think the minister mentioned last week there's 9 pieces of equipment, and I think we're all familiar now with, words like N95, but what else is kind of included in those essential pieces of equipment?
That list is actually, which started out quite small. We've actually expanded our own definition because we have looked at consumables more generally. But in the traditional sense of PPE, the items are individualized sizes of N95s, surgical masks, eye shields, face shields, gowns, gloves, hair covering, and shoe covering as a fairly basic shopping list. Now, obviously, there's less variation than one size head covering and one size shoe covering, and by and large, a couple of sizes of gowns. But because they are all ordered on different SKUs, serial numbers, the number originally started off as 9. We've also started to look at other things which we've classified as essential consumables too, and are on the same level of importance. So, for example, reagents for testing for COVID-19, swabs that we can use to actually take the samples to send to the laboratory, and also a significant part of ventilators, for example, is actually disposable tubing, used once per patient, as it were, and then replaced. So when we talk about PPE in a general sense, we actually mean things that we need immediately and over the foreseeable short term to deal with this. In the sense of the public, I think they mean it as what you would wear as a worker in healthcare to protect yourself.
Thank you.
We will now proceed with single questions.
Thank you. If you have a question, please press star 1. The first question is from Heather Gillis from CBC News. Please go ahead.
Hi there. So yesterday it was announced that a healthcare worker in St. Anthony had contracted COVID-19. What can you tell us about their interaction with patients and other hospital staff before they tested positive?
So the
Janice.
details of the case, the investigation are ongoing. There was minimal interaction, is to the best of my knowledge, with patients. And contact tracing is ongoing, and anyone who was deemed to be a close contact will be asked to be quarantined.
Thank you. The next question is from Jody Cook from NTV News. Please go ahead.
We're seeing in other jurisdictions across Canada the scale back of what was a wider parameter of essential deemed services is now being limited and pared back. Could we expect to be seeing that happening here over the coming days or weeks?
I think the issue of what is essential has always been taken in the context for us of what is required to keep healthcare ticking over and society functioning for a period lasting through into the summer. That's why some of the decisions around, for example, automobile and small engine repair in a rural province were of importance that may not have had the same impact in an urban area. We have managed to maintain chemotherapy treatment, for example, in health, and cancer surgery. The load on Ontario's health system is such that they have actually had to suspend all of that and concentrate only on COVID-related admissions and emergency admissions to hospital. We have contingency plans in place should it be the acute care centres need to be freed up to deal solely with COVID patients. So, for example, we do have overflow areas designated in each regional health authority for each of the larger centres, so the non-COVID patients could be sent there if at all possible. We're also looking at how we could possibly provide chemotherapy to patients outside of a regional healthcare facility to minimize their contact with staff and patients who would have COVID. But the facts of the case are, if we ever get to a stage where the peak is high and hits us suddenly, those are measures we may seriously have to contemplate within the healthcare system. And this is why you've heard the three of us for 3 weeks harping on about social interaction, but done through physical distancing, because that is the only reliable tool that will delay that peak. By delaying it, give us time to prepare and make that peak smaller when it arrives, so the beds we have, we can manage with.
Thank you.
The next question is from Juanita Mercer from The Telegram. Please go ahead.
Thank you. A Telegram source said that starting last week, patients in hospital with COVID-19 in the province were denied certain aspects of care, such as listening to a patient's chest with a stethoscope or running certain tests in order to protect healthcare workers. So if healthcare workers have the appropriate PPE, what's the reasoning behind this?
I can't explain any of that. That's news to me. Care is determined by the need of the patient. Personal protective equipment in hospital that is provided is of a standard that is recognized across the world as appropriate for this level of disease or contagion or spread. So the issue of the standard of care is one for the clinicians to determine, not a politician or an administrator. Our job is to do our level best to make sure the equipment, such as PPE we've talked about, is available to allow staff to do that. And staff's responsibility is to use that PPE responsibly within the guidelines and then to provide the care of the standard they would usually do for patients in hospital. The standard of care in Newfoundland and Labrador's healthcare facilities is second to none. And if there are specific instances where people feel they have fallen short, then there are mechanisms to have that addressed. I've not been made aware of any yet.
Thank you.
The next question is from Elizabeth Whitten from All Newfoundland Labrador. Please go ahead.
Thank you. I know this came up on Friday, but it happened pretty late in the day. Minister Haggie, I was wondering if we had an update on the potential impact of the order from Donald Trump not to prohibit M3 from exporting masks to other countries, including Canada.
That would have an impact. The exact magnitude for us in this province is not immediately clear yet because, A, we're not sure what percentage of our masks would come directly or through the feds from 3M in Minnesota, nor do we know whether or not 3M are actually going to comply with it. And if they don't comply, whether or not the federal government are going to hijack the loads at the border, which apparently has already happened with another jurisdiction's supplies. The issue in the States is one that is totally unpredictable. Our main thrust now is to look at multiple sources of PPE and not just relying on the States. The challenge has been that this is a global operation, and there are usually well-established large volume manufacturers, and one of them is 3M. And given the fact the others all originate from near Wuhan in China, that's put something of a strain on the procurement system. But we are on it, and we're working with the federal government, and as the Premier referenced, we have put significant civil service resources into health to look at procurement for this crisis. So we're doing what we can. Ask me in a week how successful we've been.
Thank you.
Thank you. Once again, please press star one at this time if you have a question.
Operator, I'd just like to find out if any of our speakers have any further remarks they'd like to make before we go to the next set of questions.
We're good?
Okay, proceed.
Thank you. The next question is from Jody Cook from NTV News. Please go ahead.
I'd just like to circle back to the granular information sharing point that was made. When you talk about the map that will indicate the locations of disease, do you expect that map will also show the amount of tests being done in each jurisdiction?
We can certainly break out the tests by region. I mean, I can give you that information now if you have a pen. We have done 2,728 tests in Eastern, 244 in Central, 349 in Western, and 235 in Labrador-Grenfell. That's the number of people tested for a total of 3,556. Some of those patients will have been tested multiple times, so the number of tests vary. The reason for the variation is related to contact tracing, as that has been used to guide testing, because we are engaged in targeted testing of specific groups of individuals, and that's why you'll see the difference there.
Okay, thanks for that information.
Operator, during the second round, we didn't get a question from Ben Murphy from VOCM, and I know he's there waiting on the line to ask, so could you please see if you could get him? Thank you.
Mr. Murphy, please press star one.
Hello?
We got you? Ben?
Hello? Yeah.
Ben? Yeah, sure, go ahead.
Yeah, okay, great. You just went over the number of testing per region, but a lot of people on the West Coast feel there is a serious lack of testing happening over there. What do you say to them?
The testing is done on the basis of clinical and public health criteria. The issue around the numbers is generated by the high-risk groups that we've identified. If it's low, that's a feature of the fact that so far Western Health has only had one person identified, and the contact tracing from that has generated the numbers it has.
Thanks.
The next question is from Heather Gillis from CBC News. Please go ahead.
Hi there. I understand the town of Happy Valley Goose Bay has added its voice to the list of groups in Labrador asking for travel to be halted, especially as there are a group of workers from Muskrat Falls coming into a camp-like setting. What is your response to those concerns?
Well, any operation and any employer, which would include, you just mentioned, if it was, Muskrat Falls, and as you know now, this is really in a care and maintenance. There's no significant construction going on at that site now. It's been in care and maintenance for quite some time. So people that would be traveling right now would be essential only. We have discouraged, and we've made it all, I think all of us, on every occasion we get the opportunity to speak, is that there's not non-essential travel. It's just not necessary and inappropriate at this time, no matter which region of the province you're traveling to. If that's Labrador, if it's no matter where it is, it's really essential travel only. So there's no question there's some people in Labrador that's been reaching out, but we've heard from people around the province as well as trying to isolate, their area. But right now, as been just mentioned, I think the map will be very supportive as we get more information into the hands of the public, as Minister Haggie has been mentioning already. Getting this information, there's a sense out there that this is really a St. John's-based virus only, and it's not. It's spread around our province, and I think, as I said in my remarks, no matter where you live, we must live and act as if the next person you see is positive for COVID-19. That's the way this is. So regardless of what barriers you put up, we must all live with the recognition that that next person could be positive. 19. It's in our communities. We know this, But practicing safe and social distancing, physical distancing, is the best tool that we have. So regardless of what guidelines we put up there, the one that works best is physical distancing.
The next question is from Juanita Mercer from the Telegram. Please go ahead.
It seems that all of our concern about physical illness with this pandemic is creating some very real social or community illness, if I can call it that. You know, judgment and fear of our neighbors, people taking photos and videos of others and then posting it to social media with accusations. What do you suggest we do about this pandemic of pettiness? And do you think government can play any kind of a role in this?
I think, if I would respond to that, and others can, given their own experience, as I said in my remarks today, there's no question that this is a different world. This is a very different province. And we often think about and reflect on the various things that really changed and became critical turning points in our province. I think back to 9/11, the way we travel changed considerably, and it changed for the rest of our lives. And there's probably and the more I think about it, I think COVID-19 and this pandemic will probably even more so. The way we socially interact in the future will be very different than what we're used to for all our lives. And I look at, even as I mentioned this week too, some of the children that we're seeing in our society who are 3, 4, 5, or 6 years old now having very difficult to figure out why it is their grandparents are treating them differently, why it is that grandparents are looking at them through a glass as opposed to being there and having some fun and playtime with them. So as we work our way through this, obviously we encourage people to, even though we stay apart, we practice physical distancing, we must find another way and new ways, and be very creative in how we connect with one another. And social media will help us with that, but we all know that social media can actually be unhelpful in many cases as well. So the responsibility on all of us, I think, as mature adults, to figure this out, in many cases on an individual, by our individual needs, but keeping in mind that the world has changed and we will continue to evolve as we socialize. But right now we're in the middle of this crisis. As we said, the surge, we're not even hit that surge yet, but we must stay focused and practice physical distancing and the guidelines that the Chief Medical Officer has put in place as we prepare for the new realities and that we socially interact in the future.
The next question is from Jody Cook from NTV News. Please go ahead.
There's been some question surrounding this style of media briefing, which happens, of course, every day, from some of our viewers, listeners, and readers to the media, suggesting maybe there could be an offer of a virtual town hall where residents of the province might be able to submit a question and ask their own. Has that been a conversation or discussion that's happened there?
We have various mechanisms in place through our website that people can phone in or that people can email various questions that we would have. I know even through my own email address, there's always questions that will come in on a regular basis, from ideas, and so there's lots of points of contacts through our elected officials and through our departments and within our regional health authority as well. But a virtual town hall where we could have people that could address those questions is kind of where we've been. I know many of the media have been, addressing concerns questions that would come to them directly. I've heard many of the reporters would say that this is an email or a direct message on Twitter or through Messenger on Facebook and so on. They've been able to relay those messages. But we have various mechanisms right now for members of the public to ask information and seek information on the websites and email address that we have currently available.
The next question is from Juanita Mercer from the Telegram. Please go ahead.
When I read through the World Health Organization's guidance on testing, the approach to testing that we have here in Newfoundland and Labrador seems to be the one that the World Health Organization is suggesting for places with limited testing resources. Why is it that we're following guidance for a place with limited testing resources?
One of the challenges that we have at the moment is around appropriate use of the supplies we have. There is nowhere in North America that has unlimited access to unlimited testing. What we have are supplies of swabs, supplies of reagents, and supplies of PPE, and you need all of those and lab staff, which we do have, to run a testing service. What we are doing is using those wisely on the basis that tomorrow our next batch delivery of swabs, PPE, or masks may never arrive. Because if we don't, then we are not being good custodians of the best public interest. We have to get the best effect we have from what we have. And if those supplies do not arrive, and until they actually land in our warehouses, there is absolutely no guarantee that any of our suppliers will actually be able to deliver. We have had support from the federal government. Some of our suppliers have delivered some of our requests, but as yet, I don't think any of our suppliers has been able to guarantee us dates beyond next week, and those dates are speculative from our point of view. We're not counting any swab until it arrives in our warehouse. So for the moment, focus testing is an accepted, time-honored technique. It has yielded us the benefits, and we will follow in line with best practices. Now, if you look in other jurisdictions in Canada, they are actually being more restrictive with their testing, whereas Dr. Fitzgerald actually announced a relaxing of criteria to include vulnerable groups, the people who we need to protect, at a time when other jurisdictions in Canada are actually cutting back on the scope of their testing.
I think it's fair, too, when you look at the analysis and what the minister put out there in terms of testing and the numbers of testing. And as the chief medical officer has already said, is that we've been doing a lot of targeting, very strategic type testing. So if you remember when we identify a cluster, and right now if you look at the Eastern region, Eastern Health Authority, so that would be a large region within our province. And when you look at the number of population per 100,000, it would be at about 840 odd per 100,000. So if you look at that single area and see the impact of targeted testing, because the cluster we needed that through contact tracing, we're right up there when you compare us to other from the national testing. So it's basically doing it, I guess, in a nutshell, is make sure you do it appropriately, as the minister said, but have yourself equipped that when the targeted strategic type testing is required, you have the ability to do that as well.
Thank you.
There are no further questions on the phone lines at this time.
So in the interest of time, I want to ensure that Ben Murphy, Heather Gillis, and Elizabeth Witt have ample opportunity to ask questions. So do either of you have questions before we conclude our news conference?
Heather Gillis has queued up. Please go ahead, Ms. Gillis.
Minister Haggie, as you were just speaking about our testing resources and how the province is approaching that, how many test kits do we have here?
I couldn't give you today's figure. I can get it for you and send that along. We can supply that without any difficulty. I think, actually, to be fair, I may have jumped on Dr. Fitzgerald, who wanted to comment about testing, but again, I'm on the phone line, so I may have misinterpreted that. But we can get that number for you.
Well,
Thank you.
That's fine. You answered it perfectly.
Like you usually do.
No further questions at this time.
Thank you, everybody, for attending from throughout Newfoundland and Labrador and across the country. We ask you to tune in again tomorrow at 2 p.m., 1:30 in Labrador, for our next media availability. Thank you so much.
Thank you.